I'm about to show you the 5 most common errors when interpreting the FACEP exam. I'm Matthew Lipton, an emergency medicine physician that did an additional year of fellowship training in emergency ultrasound. I'm currently the Director of Quality Assurance, which means I review the accuracy of thousands of point-of-care ultrasounds every year. In this video, I'll review the 5 most common errors interpreting the FACEP exam. If you've never seen these errors before, it's important that you learn about them now so you won't make the same mistake. As my mentor once said, the eyes do not see what the mind does not know. Be sure to watch until the end of the video to see the most important artifact that leads to a false positive FACEP exam, which was only recently reported earlier this year in 2024. Here are the top 5 errors that I see during the EFAS interpretation. Starting off at number 5 is edge artifact, then it goes to epicardial fat pad, perirenal fat, subcutaneous air, and then you'll have to wait for the last one. Here's a classic example of edge artifact that appears between the liver and the kidney. You'll notice that there's an anechoic line between the liver and the kidney that can mimic free fluid as seen here. Here's a still image of the edge artifact, and here's the physics behind it. When a sound wave hits an interface tangentially, there'll be a refracted sound wave. There'll also be an area where there's no sound waves coming from, which the computer interprets as anechoic or a black area, leading to an edge shadow. Number 4, the epicardial fat pad. You'll notice here on the interface between the liver and the heart, there's what seems to be an anechoic area, but if you look at it closely, it's hypoechoic and marbled, which indicates that there's fat there. This is the same patient in a parasternal long axis view. Notice that there's a hypoechoic area here, in which we describe as a marbled echo texture, similar to a fatty cut of steak. This indicates that there is a pericardial fat pad. A true pericardial effusion should be completely anechoic and should start posteriorly back here near the descending thoracic aorta. Here's another example of a epicardial fat pad on a separate patient. You'll notice it has that heterogeneous hypoechoic and hyperechoic region here that again we described as a marbled appearance. This is an epicardial fat pad and not a true pericardial effusion. And this is the same patient in the parasternal long axis view. Again, we have the fat pad anteriorly. We have no anechoic fluid that collects posteriorly near the descending thoracic aorta. Now we move to number 3, perirenal fat. You'll notice this hypoechoic region between the liver and the kidneys seen here. Now most people think that this is a positive FACEP because it can simulate free fluid in Morrison's pouch. However, just like the epicardial fat, you'll notice it has that marbled appearance. This is not actually free fluid. This is significant perirenal fat leading to a false positive FACEP exam. Now we move on to number 2, subcutaneous air. This is more common in the trauma patient and can be seen in the abdominal or thoracic portion of the exam. Let's start abdominally here. As you put the transducer on the patient, you'll notice that there is just a dirty shadow coming from the subcutaneous region. You see no evidence of intra-abdominal organs here. If you move your transducer though, you'll start to see normal intra-abdominal organs. So this is the same patient, we just moved the probe cephalad. You'll notice now you can see the liver and the kidney, and this is normal bowel appearance. We call this window shopping, or moving the probe around until you find an adequate window. Here's another example of subcutaneous air, this time in the thorax. You'll see what looks to be like a rib here, but you'll notice that there's no pleura underneath the rib. There's just an echogenic line at the level of the rib, and this is subcutaneous air mimicking pneumothorax. You must see the actual pleura underneath the rib in order to evaluate for a pneumothorax. This is the same patient with the probe moved just cephalad. Notice now we can see the ribs with the normal shadowing, the pleura just beneath it, and lung sliding is present, indicating no pneumothorax. There's even B lines, likely indicating pulmonary contusions. This would be a false positive if you thought that subcutaneous air was actually a pneumothorax. And now we move on to the number 1 error. Can you guys see it here? Look between the liver and the kidney. You'll see an anechoic region between the liver and the kidney that appears to be free fluid, but it's not. This is an artifact that was recently described in 2024 called the Lipliner sign. The good news is that there's a way to fix this one. This artifact is thought to be due to software designed to enhance the borders to different anatomical structures. I'm going to post instructions of how to change the ultrasound settings on the Sonosite and Mindray machines to reduce this artifact, but I want to show you a couple more examples so you know what it looks like. Here's another example of the Lipliner sign as you fan through the liver tip. You'll notice the anechoic region at the liver tip that appears as you fan through it. This is not actually free fluid. Here's another example of the Lipliner sign. As we fan through the liver, we'll see that anechoic stripe. Notice that the thickness of the anechoic stripe is actually fairly consistent the entire way. This is a telltale sign of the Lipliner sign. So here's an example of an actual true positive FACEP exam. Notice that compared to the Lipliner sign, this free fluid seen here is still anechoic, but the thickness of the stripe actually varies across the liver edge. This is a true positive FACEP exam. To summarize, these are the 5 most common errors I see with the FACEP exam, and you've got to know them so you don't make them yourself, especially that sneaky Lipliner sign. Let me know if you agree in the comments below, or if you think there's a more common error that I'm missing and that you'd like to see in a new video. Thanks.